Wanna pass the NCLEX? Then let's get started. Today we're covering a respiratory case study. Miss Smith, a 65-year-old female, presents to the emergency department with complaints of worsening shortness of breath over the past 3 days. She has a history of chronic obstructive pulmonary disease and is a former smoker. On assessment, she is tachypneic with audible wheezing on expiration. Oxygen saturation is 88% on room air. She is using accessory muscles for breathing and appears anxious. The nurse's note states that respiratory rate 28 breaths per minute, heart rate 110 beats per minute, blood pressure 140 over 90, oxygen saturation 88% on room air, breath sounds, diminished breath sounds with wheezing heard bilaterally, use of accessory muscles present, cyanosis absent. Nurses notes interventions administered supplemental oxygen via nasal cannula at 2 liters per minute to maintain oxygen saturation above 90%. Initiated continuous cardiac monitoring. Started nebulized bronchodilator therapy with albuterol. Initiated corticosteroid therapy with prednisone. Assisted the patient with relaxation techniques to alleviate anxiety. What is the priority nursing intervention for this patient? Administer supplemental oxygen, start nebulized bronchodilator therapy, initiate corticosteroid therapy, assist with relaxation techniques. Pause the video and select your answer. The correct answer is A. Administer supplemental oxygen. The priority nursing intervention is to ensure adequate oxygenation. Miss Smith oxygen saturation is below the normal range, indicating hypoxemia. Administering supplemental oxygen helps improve oxygen saturation and prevents hypoxia, which is crucial in managing respiratory distress. You can pause the video and go through why the other options were incorrect. Which assessment finding supports the diagnosis of COPD exacerbation, tachypnea, audible wheezing, use of accessory muscles, diminished breath sounds? Pause the video and select your answer. The correct answer is B, audible wheezing. Audible wheezing is a common finding in patients with COPD exacerbation. It results from narrowed airways due to bronchoconstriction and inflammation. While tachypnea, use of accessory muscles, and diminished breath sounds may also be present in COPD exacerbation, audible wheezing is particularly characteristic. Which medication is the most appropriate initial treatment for acute exacerbation of COPD? Nebulized bronchodilators, systemic corticosteroids, antibiotics, mucolytics. Pause the video and select your answer. The correct answer is A. Nebulized bronchodilators. Nebulized bronchodilators, such as albuterol, are the first line treatment for relieving bronchospasm and improving airflow in patients with acute exacerbation of COPD. They work by dilating the airways and reducing airway resistance, thereby alleviating symptoms like wheezing and dyspnea. What is the rationale for initiating corticosteroid therapy in this patient? To treat underlying infection, to reduce airway inflammation, to improve muscle clearance, to prevent bacterial resistance. Pause the video and select your answer. The correct answer is C, to reduce anxiety and dyspnea. Relaxation techniques helps reduce anxiety, which can exacerbate dyspnea and respiratory distress in patients with COPD exacerbation. By promoting relaxation and reducing stress, these techniques can help improve the patient's overall comfort and coping with breathing difficulties. Which laboratory finding is indicative of respiratory acidosis in this patient? pH of 7.35, PaCO2 55, 8CO3 26, PaO2 70. Pause the video and select your answer. The correct answer is B, PaCO2 55. Respiratory acidosis is characterized by an increased arterial carbon dioxide level of greater than 45 with a pH below the normal range 7.35 to 7.45. A PaCO2 of 55 indicates hypoventilation, leading to retention of carbon dioxide and subsequent respiratory acidosis. Which nursing intervention is essential when administering nebulized bronchodilators to this patient? Monitor serum electrolyte levels, assess lung songs before and after administration, administer the medication via intravenous route, encourage the patient to cough forcefully after inhalation. Pause the video and select your answer. The correct answer is B. Assess lung songs before and after administration. Assessing the lung sounds before and after administering nebulized bronchodilators helps evaluate the effectiveness of the medication in relieving bronchospasm and improving airway clearance. It allows the nurse to monitor for changes in breath sounds and respiratory status. What complications should the nurse monitor for when administering systemic corticosteroids in this patient? Hyperglycemia, hypokalemia, hypotension, hypocalcemia. Pause the video and select your answer. The correct answer is A. Hyperglycemia. Systemic corticosteroids can cause hyperglycemia by increasing gluconeogenesis and decreasing glucose uptake in peripheral tissues. Patients with diabetes or pre existing hyperglycemia are at a higher risk, so monitoring blood glucose levels is essential during corticosteroid therapy. What education should a nurse provide to the patient regarding home management of COPD exacerbation? Avoid all physical activities to conserve energy, use supplemental oxygen continuously at home, perform pursed lip breathing during dyspneic episodes, discontinue all prescribed medications during exacerbations. Pause the video and select your answer. The correct answer is C. Perform pursed lip breathing during dyspneic episodes. Pursed lip breathing helps alleviate dyspnea by slowing the respiratory rate, prolonging expiration, and promoting better gas exchange. It can be taught to patients with COPD during exacerbations or periods of increased breathlessness. What is the appropriate nursing action if the patient develops sudden agitation and confusion? Administers sedative medication, checks oxygen saturation and respiratory status, encourage the patient to take deep breaths, increase the dose of nebulized bronchodilator. Pause the video and select your answer. The correct answer is B. Check oxygen saturation and respiratory status. Sudden agitation and confusion in a patient with COPD exacerbation could indicate hypoxemia and respiratory distress. The priority nursing action is to assess the patient's oxygen saturation and respiratory status to determine the underlying cause of the symptoms and intervene accordingly. Which nursing intervention is essential to prevent VAP in a patient with COPD exacerbation or requires mechanical ventilation, limiting oral care to once daily, elevating the head of the bed to 30 to 45 degrees, administering prophylactic antibiotics, providing continuous sedation to keep the patient calm? Pause the video and select your answer. The correct answer is B, elevating the head of the bed to 30 to 45 degrees. Elevating the head of the bed to 30 to 45 degrees helps reduce the risk of aspiration and ventilator associated pneumonia in mechanically ventilated patients. This position helps prevent pooling of secretions in the oropharynx and reduces the risk of aspiration into the lungs. Click that subscribe button and join us next Wednesday. Comment below and let us know how you did.